continue to get reaction now. We're joined by Malan, who's editor-in-chief of the Bhekisisa Centre for Health Journalism. Mia, a good afternoon to you. Thank you so much for joining us. Again, I say we heard quite a bit of data from the health minister this morning, but I think the core message being the health department saying it's facing a massive problem of fraudulent medico-legal claims against it that have possibly costed to 7 billion rand. Your initial reaction?
Well, I'm not that surprised. The figures are, of course, new, but for people who have been reporting or have been in the health world for a while, we've all been aware of false claims. So this is just really a formalized way of bringing it out. For instance, I've reported on Eastern Cape hospitals for 2 decades, and I've always been aware that, for instance, in Matata, there would literally be lawyers hanging out in front of large hospitals to see which parents who've given birth come out with babies who could be disabled. Now, as you've probably heard, that the most common claim that lawyers claim for is cerebral palsy, which happens when a baby doesn't get enough oxygen during birth. And in a province like the Eastern Cape, for instance, where it's very under-resourced, the health system isn't very well organized, it often happens that a woman who needs to give birth doesn't get to the hospital in time, or that there's not enough nurses, so the person is not attended to in time. And then cerebral palsy does become something that babies are often born with, because the longer you wait to help someone during birth, the higher the chances of there not being enough oxygen or the baby not getting enough oxygen. So I'm not so surprised that the Eastern Cape and Gauteng are the 2 provinces where this seemed to be happening the most commonly, because the less resourced hospital is, so the fewer workers they have, the more likely it is that such incidences can happen. But also, if you have an under-resourced hospital with not enough workers, workers often, because they work in very stressful circumstances, get very scared if something happens. And when there's then opportunities to sell records to lawyers and those sort of things, it happens more commonly because they want to protect themselves often, or in a poor province, they might be more desperate for money than it would happen in a well-resourced environment. So in the Eastern Cape, certainly those false claims have happened for decades. As journalists, we've seen these lawyers often hanging out in front of hospitals. So it's a good thing that it's formalized now, that there's evidence of what has happened now.
Sure, you paint quite the picture, Mia, when you talk about lawyers hanging out outside of hospitals in the Eastern Cape. And of course, you know, I wonder if we describe that as almost parasitic, if you will. But also, I mean, I see almost a snake eating itself here, right? That you've got these claims taking billions out of the healthcare a pool of money, and then, of course, the health system needing to run, and then because it has less resources, you have more of incidents that can be claimed for. So very concerning. I want to talk about this, though. These aren't fraudulent issues. These aren't issues of just fraud and corruption that are not victimless, right? So we hear the story, for instance, from the minister about attorneys, and the victims are being very vulnerable families in the Eastern Cape, for instance.
Yes, certainly. We, for instance, heard of lawyers who go out, say they see parents with disabled children. It's very obvious when a child has cerebral palsy. You can see it so easily. For instance, they will be spastic. That's one of the versions of cerebral palsy. So you can see if a child is, for instance, taken into a hospital on a wheelchair and they're spastic. And they would then target those parents. And very often in the Eastern Cape, with migratory work systems, it would often be a grandmother looking after the child. And it would often be from a rural village. The grandparent would have a very limited understanding of how the law works, even how social grant systems work. So lawyers would target them and say they have SASSA forms that they need to sign for social grants, when those forms were really legal documents that made them sign for power of attorney, so that the lawyer is the person who will make legal decisions on behalf of the disabled child. And then we get cases where they would, for instance, claim for certain conditions and without the grandparent or caretaker knowing about it. And when that money then gets paid out, they take the money. They don't give either they don't give nothing to the caretaker, or they give a very small amount. And to give you an example of another rural province in the Northern Cape, there was a case where a lawyer was paid 18.7 million rands for a child who was disabled, and he only paid 6,000 rands a month to the family, which comes to 72,000 rands a year. And the SIU then discovered that case and it was stopped. But for 18 months, that is what happened. And very often when settlements are paid into a trust account, for a family, the trust account for the family hadn't even been established. It would be the lawyer who establishes a trust account under their name, which means that the money that's then paid out over a period of time and gains interest, all that interest goes to the lawyer. So really terrible things that happen, and great that it's been better.
Yeah, I mean, there's so much to look at here, right? I mean, one of our reporters, Malunga Leboy, is in the Eastern Cape, and he was just in conversation with Nehawu, for instance, and he's intending to speak to Denosa as well. We heard from the minister that a lot of these issues don't take place without the help of hospital staff, right? So there is, of course, the question around whether or not law enforcement is investigating in the right places and should be looking within the Department of Health and how to do so sufficiently or efficiently, I think.
Look, I don't think, I think it's many things that need to be investigated at the same time, which seems to be what they are doing. But when it comes to the involvement of health workers, the most common involvement is stolen records. So attorneys can't do anything without records. But where they get a lot of power, if they want to be corrupt, is to make those records disappear. So what they would do is they would go to a health worker, a nurse, say, I'm going to pay you, please get the records of this patient. Now, when that case then goes to court, the health department has nothing to defend itself with because the records are gone. And what they would sometimes do is they would use the PIA Act, the Access to Information Act, and then they know they've stolen the records, then they use the PIA Act and they ask for access to those records because they should be documents lawyers have access to in a case like that. And then the records, of course, wouldn't be there that they've already obtained illegally. They would then say either there's no evidence or they would sue for fees from the health department for not having records. And that certainly is something that needs to be addressed, the involvement of health workers, because that enables these cases. But the other thing that needs to be addressed, what the health minister did mention previously in your interview, is that we do not have a digital system for patient records, which means only in some parts of the country, in the public health system nationally, if you go and collect, say, ARVs, say, if you have HIV at a clinic in the Eastern Cape, you could go to 5 clinics if you want, because they wouldn't know each other. All the clinics wouldn't know that you've gone there. So there's no system where you could go to a digital system and say, this is the patient, this is what's wrong with them, and this is the medicine they've received. We only have paper records, which means that in some cases, these lawyers go and claim for one case in 3 different courts, or they say the patient was treated at 3 different clinics because of this paper record system. And that's something that we need to improve on.